Blood clots. They're one of the most common concerns that bring people to the ER because number one, they're scary. You find a lot of information and warnings about blood clots on the internet. And number two, they can be dangerous, and in some cases, they can be fatal as well. If you watch my channel for any length of time, you know I've talked a lot about creatine lately, not only for strength and muscle preservation as we age, but also about the data regarding brain benefits, improved cognition, fighting fatigue, especially in the face of sleep deprivation. But recently I've had several questions in the comments, legitimate concerns. Can creatine cause blood clots? Can it increase the risk of DVT or deep vein thrombosis or pulmonary embolism, something that we call a PE? So today I want to walk through that question using an article from the medical literature. I'll put the link down below if you want to read it yourself. But first, let's talk about what people often worry about when they think about blood clots and what frequently brings them to the ER. A typical scenario is a patient who might come in with leg swelling, or they have pain in their calf. And if they look up those symptoms online, invariably they're going to come across information about deep vein thrombosis or DVT. These are blood clots that usually form in the deep veins of the legs. They can form in the larger pelvic veins as well. And if clots like these break loose and travel to the lungs, they become what we call a PE or a pulmonary embolism. And as ER doctors, we always have DVT and PE on our radar. Anytime someone comes in with leg pain or swelling or chest pain, shortness of breath, most of us are thinking, or at least considering, could this be a DVT or a PE? In fact, if I see you in the ER for a kidney stone, abdominal pain, or even a sore throat for that matter, there's a high likelihood I'm going to check your legs while you're on the stretcher, strictly out of habit and precaution, mainly because we don't always know if the patient in front of us is at risk of a DVT or a PE. In the ER, the classic risk factors that we look for in terms of blood clots are recent surgery, long bone fractures, prolonged immobility, long airline flights, long car rides, or any situation where you may be immobile and can't get up and walk around freely for hours on end, cancer, hormone therapy, pregnancy, known genetic clotting disorders, advanced age, obesity, birth control medication combined with smoking. All of these can be risk factors for the development of blood clots. Creatine, by the way, is not on that traditional list. But here's the thing, medicine evolves by paying attention to the outliers, to places where things may be happening, but we've yet to connect the dots and make correlations. And that's where this discussion comes in. In 2024, an article was published in a journal called Bleeding, Thrombosis, and Vascular Biology, and it was titled The Use of Creatine and the Development of Deep Vein Thrombosis, a scoping review. This wasn't a randomized trial, not a meta-analysis, it was a scoping review, meaning the author searched the medical literature for reported cases where creatine supplementation and blood clots appeared together. After screening hundreds of articles, they found exactly 4 papers that met that criteria. And that's important. 4 papers, mostly case reports, not population level evidence with hundreds or thousands of patients, but rather just a handful of cases. What do those cases have in common? Well, this is where nuance matters. Across these reports, several patterns showed up. These were mostly young, otherwise healthy individuals. Heavy creatine use was involved. This is above and beyond the usual dosing. Significant dehydration, additional risk factors that weren't obvious at first glance. Some examples, one patient had a congenital absence of the inferior vena cava, the large vein that delivers blood back from the legs and the lower body back to the heart and to the central circulation. Another had severe dehydration. One had a long airline flight. Another had a history of rhabdomyolysis, a condition where someone experiences significant muscle breakdown from trauma or excess damage. One developed a rare cerebral venous sinus thrombosis. Another had a retinal vein occlusion. In other words, creatine didn't appear to be the isolated component in these cases responsible for blood clot formation. There were other underlying factors. So they didn't find scores of otherwise healthy adults developing blood clots with standard creatine dosing. Now, here's the physiology piece, and this is where things sometimes get oversimplified online. Creatine increases intracellular phosphocreatine, and that draws water into the muscle cells. If hydration is inadequate, that theoretically can reduce plasma volume. It can increase blood viscosity and promote sluggish venous flow. And slow venous venous flow is one part of what we refer to as Virchow's triad. Virchow's triad has three components, three factors that contribute to clot formation: venous stasis or slow blood flow, endothelial damage to the vessel walls, as well as hypercoagulability. When these factors occur together, they significantly raise the risk of clot formation. But, and this matters, this is theoretical based on physiology and rare observation. There is no evidence that creatine directly activates platelets, increases clotting factors, or promotes a hypercoagulable state all by itself. Now, what does this not mean? This does not mean that creatine is dangerous, or that creatine causes clots, or that healthy adults should automatically stop using it. In fact, the authors themselves emphasize that the overwhelming body of research still supports creatine's safety when used appropriately. That position aligns with the official statement from the International Society of Sports Nutrition, who continue to state that creatine is safe and effective for healthy individuals, including older adults. So, who should be more cautious? Because let's be honest, some people obviously have higher risk factors than others. And if that's you, it's important to take a cautious approach. Extra caution is reasonable if you have a personal or family history of blood clots, or have a known genetic clotting disorder, or you're frequently dehydrated for some reason, or you combine creatine with extreme heat, endurance events, or travel, or you're taking medications that affect clotting or affect your hydration status, such as diuretics for blood pressure control. Or you've had an unprovoked DVT or PE, meaning you developed a blood clot at some point in your life where no inciting factor was ever identified. You weren't immobilized, you didn't have surgery, you weren't dehydrated, which brings us back to the possibility that someone might have an underlying unidentified genetic clotting disorder. In all those cases, creatine supplementation becomes a shared decision between you and your doctor. For those already using creatine, how can the odds for safety be stacked in your favor? Well, number one, hydration is non-negotiable. Not drink when you're thirsty. Consistent, intentional hydration is important. Number two, avoid aggressive loading. Most people don't need 20 grams of creatine per day. 3 to 5 grams per day works beautifully, especially where muscle optimization is concerned. Number three, be cautious during travel or immobilization, long flights, long trips in cars or on trains. Hydrate, move, use compression stockings if needed. Number four, avoid stacking dehydration stressors. Hard training plus excess heat plus alcohol plus creatine. This is a bad combination. Number five, stop and get evaluated if symptoms appear, such as unilateral leg swelling, chest pain, sudden shortness of breath, visual disturbances. Those are not wait and see symptoms, so go get checked out immediately if you develop any symptoms like that. Big picture takeaway, this review doesn't condemn creatine. It reminds us of something more important. Supplements don't exist in isolation. They interact with hydration, anatomy, genetics, human habits, and behavior. Creatine remains one of the most valuable tools that we have for muscle preservation, performance, and healthy aging. It's extremely well studied, and it has a strong track record for being safe for healthy adults at recommended 3 to 5 gram per day dosing. But like anything powerful, it should be used intelligently and not casually. If you're healthy, hydrated, and using reasonable doses, there's no compelling evidence that creatine meaningfully increases the risk of blood clots in healthy adults. If you have questions about your own risk, that's a conversation to be had between you and your doctor. And despite the occasional pushback that I hear from people complaining that their doctor doesn't know jack about sports supplementation, I'm always going to encourage you to seek their input and advice. As always, my goal here isn't to scare you, it's to help you train, supplement, and age smarter, and most importantly, safely. If this was helpful, consider subscribing to the channel. If you haven't watched my previous videos about creatine and you want a little more history about how it became so popular, watch this video next. Thanks so much for watching. Please share this video with someone you feel would benefit from watching it as well. Let me know down in the comments if there are any topics you'd like me to talk about going forward. All the best to you, and I will see you in the next video.